As a heart surgeon, I've spent decades operating on aging hearts, fragile hearts, and hearts that failed far earlier than they should have. One pattern has become impossible to ignore. Many seniors are unknowingly taking a common medication that slowly weakens the heart over time. This is not fear-mongering. This is awareness. Yes. And awareness saves lives. As the human body ages, the heart undergoes natural, structural, and functional changes that significantly alter how it responds to medication. The heart muscle gradually becomes less elastic, the walls of blood vessels stiffen, and the electrical pathways that control heartbeat may slow or become irregular. Because of these changes, medications that were once well tolerated earlier in life can place unexpected stress on the aging cardiovascular system. A dose that seemed routine at age 50 may behave very differently at 70 or 80. The liver and kidneys, which are responsible for breaking down and removing drugs from the body, also lose efficiency with age. This causes medications to remain in the bloodstream longer, increasing their strength and potential side effects. As a result, certain drugs may raise blood pressure, slow the heart excessively, or interfere with its natural rhythm. Adults, even small shifts in heart rate or blood flow can lead to fatigue, dizziness, or shortness of breath. Another concern is that aging hearts are more sensitive to changes in fluid and electrolyte balance. Some medications disturb sodium or potassium levels, which can silently trigger dangerous heart rhythm problems. These reactions often develop gradually and may not cause immediate pain, making them easy to overlook. Many seniors believe that discomfort, weakness, or reduced stamina is simply a normal part of aging. In reality, these symptoms may be early warnings that the heart is struggling to adapt to a medication. Understanding that aging hearts react differently is critical because it reminds older adults and caregivers that medication safety must evolve with age. Regular reassessment is not optionally, is essential for protecting the aging heart. Many older adults assume that if a medication is commonly prescribed, it must automatically be safe for long-term use. This belief can be dangerous, especially for seniors. A drug may be widely used simply because it has been on the market for many years or because it treats symptoms quickly, not because it is the safest option for an aging heart. Frequency of use should never be confused with suitability for every age group. As the body grows older, tolerance to certain medications decreases. Even when the same drug was taken for decades without problems, some commonly used medicines can quietly raise blood pressure, increase heart workload, or interfere with the heart's electrical signals. These effects often develop slowly, without dramatic warning signs, making the damage easy to miss until it becomes serious. Another overlooked issue is that clinical testing for many drugs is often done on younger or middle-aged adults. Seniors, especially those with multiple health conditions, may react very differently. What appears mild on paper can become harmful in real life for an older patient with a sensitive cardiovascular system. Pharmacies refill prescriptions automatically, and routines become comfortable. Over time, medications are taken out of habit rather than necessity. This creates a false sense of security. When symptoms like fatigue, swelling, or shortness of breath appear, they are frequently blamed on aging instead of medication side effects. True medication safety requires constant evaluation, not assumptions. Just because a drug is popular does not mean it is harmless. For seniors, the question should never be how common a medication is, but whether it remains appropriate for their heart today. In older adults, the warning signs of heart stress caused by medication are rarely dramatic. Unlike younger individuals, seniors often do not experience sharp chest pain or sudden collapse when the heart is under strain. Instead, the signals are subtle, gradual, and easily mistaken for normal aging. This makes medication-related heart damage particularly dangerous because it can progress quietly for months or even years without proper attention. One of the most common signs is persistent fatigue. Seniors may notice they tire more quickly while walking, climbing stairs, or completing routine tasks. Shortness of breath may appear during mild activity or even at rest. Dizziness, lightheadedness, or brief moments of confusion can also occur, especially when standing up. Swelling in the ankles, legs, or feet, is another important clue that the heart may be struggling to pump efficiently. These symptoms are frequently dismissed by patients and caregivers alike. Many believe they are simply part of getting older, losing strength, or slowing down with age. Even in clinical settings, such signs may be overlooked if blood tests or basic exams appear normal. The connection between medication and heart stress is not always immediately considered. Another challenge is that seniors often adapt to discomfort rather than complain about it. They reduce activity, rest more, and quietly adjust their lifestyle, masking the seriousness of the problem. By the time clear heart failure or rhythm disturbances are detected, significant damage may already be present. Recognizing these early warnings requires attention, awareness, and open communication. Subtle changes in energy, breathing, or swelling are not insignificant. They are the heart's way of signaling distress and should always prompt a careful review of medications and overall heart health. As people age, it becomes increasingly common to take multiple medications each day to manage various health conditions. While each prescription may seem necessary on its own, the combined effect of many drugs can place serious strain on the heart. This situation, known as polypharmacy, is one of the most underestimated threats to senior health. The aging heart is forced to adapt to overlapping chemical effects that were never designed to work together in an older body. Each additional medication increases the risk of drug interactions. Some drugs may amplify the side effects of others, raising blood pressure, slowing the heart rate too much, or disturbing the heart's electrical rhythm. Others may interfere with medications that are meant to protect the heart, reducing their effectiveness without obvious symptoms. Over time, this hidden imbalance can weaken heart function and increase the risk of heart failure or dangerous arrhythmias. The liver and kidneys, already less efficient with age, struggle to process multiple drugs at once. This causes medications to accumulate in the bloodstream, making even standard doses behave like overdoses. Seniors may experience fatigue, dizziness, swelling, or shortness of breath without realizing that the true cause is medication overload rather than disease. Progression. Another danger of polypharmacy is fragmented care. Different specialists may prescribe medications without full awareness of what others have recommended. Prescriptions are added but rarely removed. As routines form, medications are continued out of habit, not necessity. This silent threat does not announce itself with sudden pain. It builds gradually, quietly stressing the heart day after day. Reducing unnecessary medications and reviewing all prescriptions regularly is essential to protect the aging heart from avoidable harm. Many seniors place complete trust in their prescriptions, believing that if a medication was given by a professional, it must always remain appropriate. While trust is important, silence can be harmful. As the body changes with age, medications that were once helpful may no longer be the best choice for the heart. This is why seniors must become active participants in their own care and learn to ask the right questions. Aging affects how the heart, liver, and kidneys handle medications. Without regular review, dosages may remain too high, or drugs may continue long after their original purpose is past. Seniors should feel empowered to ask whether a medication is still necessary, whether the dose is correct for their age, and whether it could be affecting blood pressure, heart rate, or heart rhythm. These questions are not challenges to medical authority. They are essential safeguards. Many older adults hesitate to speak up, fearing they may appear difficult or ungrateful. Others assume new symptoms are unrelated to medication. Fatigue, swelling, dizziness, or breathlessness are often reported without mentioning recent changes in drugs or dosages. This prevents doctors from seeing the full picture. Regular conversations about medications can uncover safer alternatives, lower doses, or non-drug approaches that reduce strain on the heart. When seniors ask about interactions between prescriptions, they help prevent silent damage caused by overlapping effects. The most protected patients are not the quietest ones, but the most informed. Asking thoughtful, consistent questions transforms seniors from passive recipients of care into partners in protecting their heart health and preserving their independence. After years of treating advanced heart disease, one truth becomes clear: repairing damage is far more difficult than preventing it. Surgery can restore blood flow, replace valves, and correct structural problems, but it cannot undo years of silent strain placed on the heart. For seniors, prevention offers a safer, more powerful path to long-term heart health than any operation ever could. The aging heart responds best to early protection. Regular monitoring of blood pressure, heart rate, and subtle changes in stamina can reveal problems before they become emergencies. Reviewing medications on a routine basis helps identify drugs that may be placing unnecessary stress on the heart. Small adjustments made early can prevent major complications later. Lifestyle choices also play a critical role. Gentle physical activity keeps the heart muscle strong, while proper nutrition supports healthy blood vessels and balanced electrolytes. Adequate sleep and stress management reduce the constant strain that accelerates heart decline. These measures may seem simple, but their combined impact is profound. Prevention also means responding quickly to new symptoms, instead of ignoring them. Fatigue, shortness of breath, swelling, or irregular heartbeats should never be accepted as normal aging. When addressed early, many heart problems can be slowed or even reversed without invasive procedures. Surgery will always have an important place in medicine, but it should be the last line of defense, not the first. A heart protected through prevention remains stronger, more resilient, and better able to support an active life in later years. Protecting the heart early preserves not only health, but dignity and independence as well. As this discussion comes to a close, one message must remain clear and strong. Aging does not mean surrendering heart health, and heart problems are not an unavoidable part of growing older. Many of the risks facing seniors today are not caused by age alone, but by habits, assumptions, and medications that were never re-examined as the body changed. What is considered routine or common can quietly become harmful. When the heart is no longer able to adapt in the same way it once did, awareness is the first step toward protection. Recognizing subtle warning signs, questioning long-standing prescriptions, and understanding how multiple medications interact can prevent serious damage before it begins. Seniors who stay informed and involved in their care are far more likely to preserve their strength, independence, and quality of life. Silence and acceptance allow problems to grow. Knowledge and action stop them early. Heart health in later years is not about fear, but about wisdom. It is about paying attention to the body, respecting its changes, and demanding care that evolves with time. Small, preventive steps taken today can spare years of suffering tomorrow. The heart is not just an organ, it is the engine of life, memory, and independence. Protecting it requires courage, curiosity, and communication. When seniors and caregivers choose awareness over assumption and prevention over reaction, they give the heart its best chance to keep beating strong for years to come.